So retroviruses are single-strand RNA viruses. They have two surface proteins: glycoproteins, which are for adhesions and viral neutralization, and transmembrane proteins that help the virus get into the cells. So the virus gets into the body, and using transmembrane proteins, it gets into cells. And then when it's inside the cell, it will use reverse transcriptase, and this will turn viral RNA into DNA. So when the viral RNA is turned into viral DNA, it is called a provirus. The virus then uses enzyme integrase to insert itself into the host's DNA. And when the virus is integrated into the host's DNA, the virus can stay silent in the cell for years without making new viruses. It can be chronic. Then the virus is activated and it will make new viruses, and these will spread and kill the host. The virus can then combine with the host's DNA, and this causes cancers. These are called oncogenes. And the viruses can cause immunosuppression by killing the lymphoid cells. So the retroviruses are split into 5 different subfamilies. There's alpha, beta, gamma, delta, and lenti. Alpha retroviruses have avian leukosis. Beta retroviruses have ovine pulmonary adenostomatosis. And gamma retroviruses have feline leukemia virus. And delta retroviruses have enzootic bovine leukosis. And then the lentivirus genus is equine infectious anemia, caprine arthritis encephalitis, feline acquired immune deficiency, also known as FIV, and Maidi-Visna virus. So enzootic bovine leukosis has the bovine leukemia virus. It originated from Frisian cattle in the Baltic Sea, and then it became worldwide. It has 7 genotypes, but it's a uniform antigenic structure. The 51kD glycoprotein has a geographical difference in different places. It doesn't have an oncogene, and the susceptible animals are cattle, sheep, and goats, but mostly cattle. It spreads horizontally through discharges, and there is a slow spread within the herd. This disease has 3 phases. The incubation phase is 4 months, and then the pre-tumor phase is 2 to 4 years. There are no clinical signs. And then in the tumor phase, this is at 4 to 5 years, then the clinical signs begin. So in the tumor phase, we will see enlarged lymph nodes as well as decreased milk production and infertility. And in the pathology, we will see lymphosarcomas as well as tumors on the gut, the abomasum, and the lungs and the bladder. To diagnose this disease, we can use PCR as well as ELISA for the 51kD glycoprotein. There is no treatment and there is no vaccination. For prevention, get semen from disease-free bulls as well as making sure they get colostrum at birth. And for veterinary activities, have sterile work, especially when dealing with blood. So equine infectious anemia virus is a part of the lentivirus genus. It is found worldwide, especially in swampy areas. It has 3 main antigens, P26, P45, and P90. The hosts are all equidae. The source of infection is blood from diseased animals. It can spread through arthropods or iatrogenic means. The main arthropods are horseflies and deerfly. The viremia occurs in macrophages as well as the bone marrow. There can be hemolysis and the bone marrow will become damaged, and this will cause anemia. The number of lymphocytes will also decrease, and this will cause immunosuppression. The incubation period is usually 1 month. They will get sublingual hemorrhages as well as edema. The chronic phase usually happens after 6 months. They'll have severe weight loss as well as anemia. There can be asymptomatic carriage. This virus can also cause abortion. In the pathology, we will see a flaccid heart, a hyperemic spleen, and liver dystrophy, as well as edema and hemorrhages around the body. There will also be glomerulonephritis due to the immune complexes. And we also describe the liver as having a nutmeg pattern. For the diagnosis, we can diagnose anemia, as well as using PCR and detection of the antibodies such as P26. We can also use AGP Coggins test for detecting antibodies. This is the official way. There is no treatment and there is no vaccination. So for feline leukosis, it has the feline leukemia virus, which is part of the gamma retrovirus genus. It is found worldwide in around 1 to 8% of cats. However, in catteries, it can be up to 20% of cats. The virus has 4 subgroups: feline leukemia virus A, B, C, and T. A is the predominant subgroup and causes lymphomatosis. The subtype B increases the risk of tumours when with subtype A. And subtype C has fatal anemia, and subtype C has immunodeficiency as the virus will kill T cells. The surface proteins are 27 kDa, 70 kDa, and 15 kDa. The susceptible animals are domestic cat and Felidae, and it's also spread in the discharges. The incubation period is 4 to 6 weeks. They usually get weight loss, returning fever, and diarrhea, especially if they're over 4 years old, and around 25% of cases have tumours. Tumours such as lymphosarcomatosis, where we will see diarrhea, vomiting, and respiratory signs. A persistent infection can lead to immune complexes, which will lead to glomerulonephritis. In the pathology, we will see cachexia, anemia, enlarged liver and spleen and lymph nodes, as well as tumours in the thymus. Abortions and infertility can also occur. For the diagnosis, we use PCR and ELISA for P27. There is no treatment if there's clinical signs. You only vaccinate seronegative cats. Feline acquired immune deficiency disease has a feline immune deficiency virus, which is known as FIV for short. It is a part of the lentivirus genus. It is found in around 1 to 4% of healthy cats and 40% of diseased cats. Feline immune deficiency virus has several subtypes: A, B, C, D, and E. They have no cross protection and only cats are susceptible. It mainly occurs in cats older than 2 years old, and it is more common in males due to their fighting. There is a horizontal spread in the discharges, and there can also be a vertical infection. The disease has long carriage, and asymptomatic carriage can also occur. In the clinical signs, there's a viremic phase and a persistent viremic phase. In the viremic phase, we see fever and enlarged lymph nodes. And in the persistent viremic phase, which is chronic, we can see fever, anemia, as well as rhinitis and conjunctivitis, and encephalitis, as well as tumours. It is a slow, long-lasting disease and it'll lead to death. It cannot be treated, and for prevention, have isolation of infected animals, and the vaccine is not effective. For diagnosing, you can use PCR and ELISA. Avian leukosis is a part of the alpha retrovirus genus. There are subtypes A to J that evolved from avian leukosis virus. It is an oncogenic virus. The virus forms the leukosis sarcomatosis virus complex. The virus occurs worldwide. The clinical forms of the disease are less frequent, and it mainly occurs in older animals. The antigens are P27 glycoprotein, P35 transmembrane protein, and P85 glycoprotein. The virus has low resistance in the environment, and the main host is chickens. However, it can also infect turkeys. It can be spread in the feces and saliva, and there's also a germinative infection. It is a chronic, slow-spreading disease. In the case of lymphoid leukosis, the incubation time is 14 weeks. The virus will change B cells in the bursa fabrici, and then tumours will develop, and then metastasis occurs when the animal is an adult. In lymphoid leukosis, we will see anorexia as well as anemia and decreased egg production. In the disease caused by the J subgroup, it occurs from 9 weeks of old, especially in meat-type parents. For the clinical signs, we will see tumours in the head, the breastbone, and in the leg. There will also be blood-tinted diarrhea, as well as hemorrhages all over the body. And in the pathology, we can see the long bones become widened. There will be tumours in the parenchymal organs, and there is no vaccination. For the diagnosis, we can use PCR to detect the P27 antigen, as well as using ELISA and viral neutralization. To do a differential diagnosis with Mark's disease, use the MATSA diagnostic method. And for reticuloendotheliosis, it's a part of the gamma retrovirus genus. There is subtype A and subtype T, also known as Rev-A and Rev-T. Type A is a helper and can cause immune suppression, and type T is an oncogene from a turkey cell, and it causes fast-developing tumours. Turkeys are most affected, however, chickens can also be affected. The incubation period can be between 3 days and 3 months depending on the virulence. In the clinical signs, we will see general clinical signs such as diarrhea, anemia, as well as central nervous system signs. The birds will also have abnormal feathering. And in the pathology, we can see tumours on the liver, spleen, and stomach. And for the diagnosis, we can use PCR and ELISA, and there is no vaccination. For Caprine arthritis encephalitis, it is a part of the lentivirus genus. It is found worldwide and it occurs in goats. There are two forms of the disease, arthritis as well as encephalitis. Encephalitis occurs in 2-month-old kids. They show normal central nervous system signs such as convulsions, tremors, etc. And arthritis occurs above 1 year of age. It usually happens in the carpus and the knee. Adults can also get respiratory signs. Adults can also get mastitis. The virus can be spread in milk and discharges. And to diagnose, you use PCR and ELISA, and there is no vaccination. The Maidi-Visna virus is a part of the lentivirus genus. It is found worldwide. However, it is not present in Australia and New Zealand. It is spread in discharges and milk. There are two clinical forms of the disease, Maidi, which is more common, and Visna, which is less common. Maidi occurs in older sheep, around 3 to 4 years old. They get respiratory signs, such as interstitial pneumonia. Visna occurs in sheep around 2 years old. They get central nervous system signs and paralysis. For a diagnosis, use PCR and ELISA. There is no treatment and there is no vaccination. For ovine pulmonary adenomatosis or ovine pulmonary adenocarcinoma, it is a part of the beta RetroVirus genus. It is also called Jagsticht, which means panting sickness. It occurs worldwide, however, it is not found in Iceland or Australia and New Zealand. It is a respiratory disease. They show respiratory signs but no fever. They get dyspnea, but coughing is not typical, and the virus is only isolated in the lungs. For diagnosis, we can use PCR, and there is no antibodies detected. The differential diagnosis is with Maidi-Visna, and there is no vaccination.